This is tips and tricks series for you. YAG laser peripheral iodotomy. The position and the size of the PI. The step 1 is to identify the crypts in the periphery, that is beyond the collarate but not at the extreme of the periphery. That is step 1. You can see the square box. This is where you can identify the crypts very clearly, but that crypts can be seen throughout the entire part of the iris in the periphery. This is another location, but you can select any part of the iris, but the study shows that the minimal visual symptoms are seen in the temporal laser peripheral iodotomy. So it is better we select the temporal part of the iris. The size of the PI, the minimum size of the patent PI is about 50 microns to 100 microns. You can see the peripheral iodotomy, the size in this picture with the tick marks. But you can also see there is a large peripheral iodotomy. This can be avoided. Once you do the large peripheral iodotomy, always understand that you may be injuring the lens or the zonules. So it is better we avoid either a too longer peripheral iodotomy or even a too wider peripheral iodotomy to be avoided. The next is on the post laser medication. You can use steroid medications, tapering dose over a period of either 5 to 7 days or over a period of 10 days, depending upon the number of shots that you have used or the energy that you have used. Always try to use anti-glaucoma medications in these patients to reduce the post-laser spike. Especially you can use a tablet acetazolamide if the patient is able to tolerate, or you can use even a timolol maleate as a BD dosage over a period of steroid usage period. Hope this tip is useful for you. Thank you.